I interviewed Governor Kate Brown at her office in Salem for our first non-Zoom interview with her of 2021. I knew we would talk about COVID, the vaccine, and masks. I was not expecting her to announce masks would be required for all K through 12 students in Oregon.
So let's start with masks. When we walked in the building, I noticed there is a sign that says masks recommended. Where do you stand on masks? Will you be issuing another mask mandate for Oregon?
The challenge is, of course, the Delta variant, and it is extremely transmissible. And so Dr. Dean Seidlinger is recommending, he's our state epidemiologist, he's recommending that when folks are indoors, that they be masked up.
So you're sticking with recommendation right now?
Absolutely.
What metric would we have to meet for you to change to a mandate?
So here's the challenge that we have, and that is getting more Oregonians to get vaccinated. I do not believe that a statewide mask mandate helps in that effort. We are, however, going to be requiring masks for schools, K through 12 schools, starting in the fall. We want to make sure that kids are in school 5 days a week. We know that it is the best way for our kids to learn, and it is the most effective way to stop the transmission, particularly for our younger kids who are not yet eligible for the vaccine.
Okay, so masks required for schools?
Yep, K through 12 schools.
Oregon is once again seeing an uptick in COVID cases and hospitalizations. I asked Governor Brown if she would impose restrictions or lockdowns if hospitalizations hit 300 again. That's the metric she used during most of the pandemic. She said it's time to let local public health officials decide.
Look, we are moving to a more traditional public health response, and that is at the community level, the county level.
I also asked about vaccine mandates. Oregon is the only state with a law that prevents hospitals from requiring their employees to get the vaccine. Governor Brown said she is meeting with healthcare workers and industry leaders this week to improve vaccine rates in that industry.
Would you like to see hospitals be able to make that choice?
I think it's really important for employers to encourage their employees to get vaccinated, whether they're healthcare workers, whether they're working in technology, whether they're working in manufacturing, whatever folks are doing.
So
yes, yes.
You would?
Please.
Okay.
We need more people to get vaccinated. There's absolutely no question about it.
Brown said everything is on the table, including calling a special session to reverse or pass a law allowing hospitals to have the choice. I'm Cristin, Severance, KGW News.